Let's practice an NGN item, select N. So a client's presenting to the ED with epigastric pain, shortness of breath, and dizziness. This started 8 hours ago. It's getting worse. They're pale and diaphoretic. They have a medical history of diabetes. They state their blood glucose has been very high, but when you check it, it's 110. Now, in a select N item, the stem of the question is going to tell you exactly how many choices you need to pick. So it's not like a SATA where it says select all that apply and you just pick however many you want to. They're actually going to give you a number. So here we say which 5 client findings require follow-up by the nurse. You're going to read through this list and you are going to pick 5. So my testing strategy is actually the exact same for SATA questions as it is for Select N. I recommend that you take each of these answer choices and treat it as a true or false question. And then when you get to the end, see if you have the correct number, and it'll kind of serve as a double check to make sure that you're on the right track. So let's try it. Is epigastric pain a finding that requires follow-up? True, select it. What about a blood glucose of 110? False. That's normal. No need to follow up. How about a history of diabetes? False again. As a rule of thumb, in the ED, I'm not following up on long-term past medical history. I'm more worried about acute presentations and life-threatening illnesses. So what about shortness of breath? Do I need to follow up on that? You better believe it. That is a good reason to come to the ED. That's one of our ABCs of prioritization. I should follow up. How about if my symptoms are progressively worsening? Sure thing. I do not like vital signs and symptoms trending in the wrong direction. Symptoms getting worse, patient getting worse. I don't like that as a former ED nurse. Now, what about these reports of dizziness? Is that something I expect with the patient's history and whatnot? Nope. And if I don't expect it, then it requires follow-up. Now, lastly, pale skin and diaphoresis, does that require follow-up? Well, you know it does because that falls under your C, under your ABCs of prioritization. But even if you didn't remember that, you know you have to pick 5 findings, and this is your 5th client finding requiring follow-up. So there you go, same kind of strategy as a SATA question. Turn them all into true or false questions. And then when you get to the end, use that number that you know you should have as a way to check yourself. Here, we were supposed to select 5 findings that required follow-up. And when we got to the end, we had 5 findings. So I had a pretty good idea that I was correct. You're going to get +1 for every right answer that you had, +0 for anything wrong that you selected. You're not going to get anything deducted. So you'll come out with the total of those correct answers you selected. Maximum score here was 5 possible points. Great job, future nurses. Head over to archerreview.com to practice some more. We'll see you there.